Thank you, ma'am. Yeah. Good evening, everyone. We would like to wholeheartedly welcome each one of you for the Deccan Positive Mental Health Teams session. And we have reached the 97th session. And the topic for today's session is endometriosis and emotions. And this is being organized by Manasa Shubhakara Mind Care Hyderabad, the Yellow Pond Counseling Center, India, Forest Creative Arts Studio, Punjab, Sri Deepthi Counseling Center, Hyderabad, Clover Learning Center, Hyderabad, Shrisha Counseling Center, Kozhikode, Mindstyle Hub of Kolkata. And our honorable resource person and speaker for today is Dr. Sri Priya Shaji ma'am, who's a counseling psychologist, a nutritionist of Shrisha Counseling Center. A very, very warm welcome to you, ma'am. An introduction to her, Dr. Sri Priya Shaji has a doctorate in counseling psychology, and she's also a nutritionist and an art therapist. She has 2+ decades of experience working in hospitals, which has made her skills sharpened in health psychology. Further, she has grown passionate in nutritional psychology. Her scientific publications have figured in 18 international and national journals. She also has 15 scientific presentations to her credit. She's a founder of Shrisha Counseling Kozhikode, which is affiliated to the World Mental Health Federation. She works with individuals, groups, and organizations to amplify their authenticity and empower them to become a better version of themselves. She has also founded the Women's Mental Health India, a special wing for women related issues. Co founder also. Community Nutrition Forum, Kerala, a community of nutritionists working towards health awareness and right eating habits among the general public. She is also a presiding emotional and wellness council, WICCI, Kerala. Also a renowned speaker, and her signature topics being women's empowerment to mental health through good nutrition, healthy periods, wellness and self-care, managing anxiety and stress, prioritizing mental health through good nutrition. She's also a columnist in an international magazine, Mind Matters, and has penned good number of healthcare articles in other magazines. She has delivered more than 500 health talks for general public at various community health programs. And with that very, very short introduction, I would like to hand over the session to you. A very warm welcome once again to you, ma'am. Over to you. The floor is yours, ma'am.
Thank you, Animita ma'am. It's not a short introduction. It's really brief. I was wondering. I think we should make it short next time. And most of the people also know about me. Thank you for that wonderful introduction. And directly, I'll just take a minute for screen sharing. So, how many of you are aware of this word endometriosis?
Not me.
Thank you. So, anybody? You may not be a psychologist, but as a woman, how many of us are aware of women's at least, if not men?
Yesterday, after seeing your topic, I immediately referred to a dictionary, the collection of emotions, correct?
No, sir. Endometriosis is another thing. I'll just brief that in the session.
Okay.
So, the very biggest thing is we lack awareness. Mainly, we lack awareness in women health, especially in women health. These things are totally abundant in Indian culture to speak about. That is the biggest problem for us. So that's why I have selected. Ma'am has given me the choice of picking up any topic from menstrual mental health. I thought we should particularly talk, because every issue is one topic and one subject. We should particularly speak on each and every, and to create awareness first among ourselves and also among our general public. So, endometriosis and emotions. Before going into the thing, there is another term for the endometriotic cyst. This is what they call as chocolate cyst. In the right side, you can see that blue color picture. There is a shell like chocolate, no? Like if you see just like that, you may say, think some milk chocolate is broken into pieces. But actually, that is the cyst inside the ovary of a woman. Okay, so this has this deeper dark brown color, so it is called as chocolate cyst, and this is not so very chocolatey. The life becomes bitter with this. So actually, already Sonanda ma'am, Anita ma'am has given a brief introduction. So I'm just skipping my introduction and entering into the topic. Endometriosis is a disease in which tissue similar to the lining, there is a tissue, another separate tissue similar to the lining grows inside the uterus. Sorry, outside the uterus, not inside the. It should be grown inside the uterus, but it is also growing outside the uterus. That is when it is called endometriosis. And this endometrium thickness should grow when they are pregnant or during periods. But when this comes outside the uterus, there is more severe health complications. It can cause severe pain in the pelvis and make it harder to get pregnant because the thickness is too much so that the child cannot get attached to the uterus, or that is the problem with that. And with the endometriosis still like leading to severe inflammation, that is another important thing, and also causes the scar tissue. Once even the cyst is all collectively removed and thrown out of the body, still the scar and inflammation is very badly there. And in some severe cases, this endometriosis also may cause adenomyosis and fibroid tissues, and this also develop and go to the bowel and bladder. So this is why this person with endometriosis not only suffer with one just pelvic pain, they suffer with the entire body pain, muscular pain due to the inflammation. They get severe stress, and very important of any other increased profuse bleeding, and that leads to anemia. So this is a kind of uh, cycle which adds on to problematic phase of their menstruation. So this also causes gastrointestinal congestion, and this also duplicate irritable bowel syndrome. So there are so many other things which caused by endometriosis that mimics the other health issues. So what is the cause of this endometriosis? Even WHO says that the cause of endometriosis is unknown, and it can start at person's first menstrual period, even at the very beginning, first menstrual period, and it may last till their menopause. So, as I said already, the symptoms will be pelvic pain, painful periods. That doesn't stop with that just pain for themselves. Even pain during their intercourse and heavy, profuse menstrual bleeding, and this altogether leading to infertility issues. So, what way this physical problem of a woman is going to affect us psychologists? Endometriosis carries a social impact due to the lack of awareness, delays in diagnosis, because people are not aware this such condition exists, and we are not even aware of going and showing this. We generally think, especially in Indian females, we think pain is common to all. Everybody suffers, endure it. So this is a very common statement given. So because there is some problem not detected in the initial stages, this is limiting the treatments, and the stigma around the menstrual health is very bad in our country. So we are not even ready to, even in educated society, many people are not even ready to express that I'm suffering from so and so. This is the another problem. And if there is some problem like this, next another very important societal stigma is getting married becomes a problem. So we don't want to talk or treat this. We want to keep this very, what to say, secret. So these things also, this social impact also is adding volumes to the problem. And early diagnosis and proper management is definitely crucial, and in improving the outcomes, or not only in reducing the pain, but also preserving fertility helps in early diagnosis and proper management, and enhancing the overall well-being of the individuals with endometriosis. So I can say Her Excellency has bring in several other problems, as I said earlier, like what we call metabolic syndrome, that is diabetes, hypertension, heart problem. Like this, here endometriosis is also associated with several other problems, autoimmune problems, brain fog, painful bladder, that is every time they pass or urine motion or urinate, they have a painful bowel and bladder. Some people even have a severe constipation, and persistent pain will be there. They will be continuously complaining on chronic pain. This is also there, and gastrointestinal distress. And very important is, as earlier mentioned, infertility. In some women, they also have the problems like abdominal bloating, nausea, fatigue, And this is also not sometimes, most of the times, it is leading to depression, anxiety also. So, what are her take on mental mafia? I can say that this endometriosis totally take a person's personality, and this is bringing in several different issues, because it's not just a society or the general health. It also implies on the economical implications. It can decrease the quality of the person's life. Quality of life is decreased because of this continuous chronic pain, fatigue, always tired, feeling not interested in doing things because always tired, not interested in exercising. So they may easily get into even non-communicable diseases. So that way again, it is also building up economical implications. And this debilitating pain also prevents many women to like pursue their further education. That way also, like so many are doing school dropout, or they doesn't want to pursue a very good professional or good courses. They just want to just make one certificate and just stay back at home. And very important is marital life is getting into trouble. Painful sexual intercourses are like interrupting, or they may even avoid this, and that also causes problem not only in the marital life, also affect the individuals and their partners. So this is again causing the problems in the marital life. So this, until they are married, they are not going to know that there is a problem existing. So that way again, it is a problematic. So addressing endometriosis will empower those affected by it by supporting their human right. That is what this World Health Day we are speaking about. Health is everyone's right. So empowering with every, creating awareness is everyone's right, and human right is prevented or supported by bringing in social education. And this helps them to improve their standard of emotional life, mental health, physical health, also reproductive health. So the quality of life and overall well-being can be increased. So what are the issues they very commonly mentally suffer? Anger, anxiety, fear, panic, increased pain threshold. Like even in early days, we have not seen many women having that infertility issues. But over the 30, 35, 40, when this age, we can see their total persona is changed. They will be very sweet, talking person who may turn into suddenly very irritable, kind of agitated always. If you even just want to say some hi, they'll say ah. So this kind of irritating behaviors are increased because of the pain threshold. They may not be aware of what they are suffering. That is another thing. They reduce the social interaction. They doesn't feel like going and attaching with anybody. So they just distract themselves and just stay back at home. And very poor mood, depression. So why they are often experiencing this mood disorders, mainly because of not just pain, because of the hormonal change. The total hormones, especially estrogen levels, are increased, and this LHPH, LH and follicular stimulating hormone and luteal hormone is also changed. So their uh, pace of ovulation will be little higher, but their LH phase will be very less. They may get early periods. Maybe we can say that 25 days periods or 28 days periods, and there will be excess bleeding. Because of this excess bleeding, their iron anemia is also increasing. So nutritional deficiency is also caused. Not only nutritional, the hormonal imbalance is also causing emotional and cognitive issues. That's why the mainly brain fog I have mentioned earlier. The brain fog is also caused because of this hormonal imbalance and nutritional deficiency. This nutritional deficiency is not because they are not eating; they are might be eating properly, but because of the profuse bleeding, it is affected. So living with this chronic pain also triggers, because always pain. What is it? Nobody is diagnosing. How can I find out what is happening inside me? So this also triggers their emotional response. They will be living in the fear and uncertainty. So this is also causing the frustration. Why this pain is, and a very common thing. What happens is when such people, especially even arthritis cases or chronic pain patients, when they keep saying that I have some pain, this pain over a period is neglected or thought to be attention seeking, or that has been easily avoided with some societal stigmas. What is this? Everybody is having pain. Why are you exaggerating? We are saying that they are exaggerating because we think that pain threshold or the pain conditioning is very less, and the society totally, not society, the family totally avoids this because they are hearing this for a long time and they couldn't see a very proper diagnosis with because they are not aware. So these conditions, prolonged suffering, sometimes also leading to post-traumatic stress disorder, self-doubt, feelings of helplessness, necessitating comprehensive mental health support. So these are the areas which a psychologist has to step in. So, what is this pain and discomfort? As I said earlier, this severe pelvic pain is very commonly, very commonly addressed as poor pain intolerance or attention seeking in our society. So, this common ideology or the societal stigma behind this is adjust. How long I should adjust? None of us are aware of it. How long I should adjust, or what is the limitation of my pain? When should I speak? At least, even in the profuse bleeding case, people can say, after this much of thing, Flo, you should inform us, doctors, gynecologists will say. But when it comes to the pain, when should I yell? When should I speak out? When should I share? This is where the problem arises. And most of the time, what happens is, due to the severe pain and constant adjustment, they never say the this is not actually the resilience. The volume of adjustment is not properly, like how this frog is adjusting its body's thermal temperature to the hot boiling water. People adjust at their maximum only when they are totally exhausted. They say, I'm in pain, they shout, or they bring it out as a very big issue. Aggressiveness is provoked only after the extreme levels are attained. So this is the problem. And constant battle with the pain also pulls their value. So they will start thinking that why I'm saying this? Is it some problem with me? So is that really as what they believe? I don't have any problem. Why am I seeking attention? So these kind of things together makes them feeling hopeless and bring a lot of despair in a person's mental health. So this uncertainty is also flaring up, and I'm sorry, this unpredictable symptoms flares up and brings in no cure. They are not, because they're not able to understand why I'm moody today, why I couldn't speak out well like previous session, or why I couldn't smile at my friend after a long time, because everything is unpredictable, even to the self. So their mood is totally unpredictable, and this symptoms flaring up is causing societal trauma. Their own self doubt is created, because last time I performed well, this time I couldn't perform. What is wrong with me? I'm not aware. So such traumas, personal traumas also is flaring up, and there they get exhausted, and this is bringing in lot of anxiety. Next area, whenever they go meet somebody or new person or new interview, they get lot of anxiety, whether I will be pulled back with uncertainty or unknown fear or unknown reasons of lack of mood or lack of confidence. What is going to happen next? And this, not only in this volume of social relationship or parental relationship or even official relationship, but it deeply affects the personal family relationship. That's where their relationship mostly gets strained, and the limitations are imposed by the conditions. So there the energy levels are reduced, and this automatically brings in a deep wounds in the not only family life. Because of the collapsed family life, they could not even join with the society social activities, and this brings in a lot of isolation, loneliness, and also emotional distress. The next very important, irrespective of adjusting to everything and fighting and motivating themselves, the very important concern becomes the fertility concerns. So this individuals with I'm sorry, endometriosis may experience emotional turmoil due to the concerns of fertility, because the society needs to be answered. Once you are married, you should immediately tell when is your vishesham, what is going to happen to you next. So this is the constant push behind this women, and every month the delay is going on. Every month, not only the societal pressure, even every women, or most of the women I can say, love to have their own children and they long for that beautiful relationship. So this personally also brings in a lot of despair to see that they are not pregnant or conceived, and this brings in a lot of grief and guilt, and totally they feel like I'm inadequate, I'm not a complete woman. There are so many women says I'm not a complete woman, that's why all the problems are. So the ovulation is good, everything is good, but why I couldn't conceive? This question will be a very big battle for them. And what happens with the challenges in diagnosis is, very often this emotional roller coaster is not very easily addressed, because we lack, first and foremost reason is we lack awareness, and we are not connecting this during periods or during menstruation, PMS, or during ovulation. There is some changes, that is what affecting this women. This is not understood deeply. That is when the problem is getting more triggered, and there all the problems, when there is a problem, is just understood and addressed by the concerned family members, at least 50% of problem can be reduced. But here, the husband couldn't understand, or the in-laws couldn't understand, parents couldn't understand, and this woman herself lives in a self-doubt, inadequacy, and she herself is fatigued, physically exhausted, mentally exhausted. So this all together is increasing the problem like a vicious cycle. And this, they think that there is some psychological problem, but they are not directly addressed to the what is that main thing. Because the tip of the iceberg is seen, anger is seen, irritation is seen, fear is seen. So some people, if she is a working woman, then immediately people will complain, oh, work is enough for you, or you're not interested in having children. Or some people will keep on triggering, why are you not deciding? So this kind of irritation and agitated mood responses will be taken and developed with the stories, which again come buffering her as a, there is some monster in her. So she starts doubting. So this delays the problems, and the diagnosis totally misleaded to somewhere else and impacts mental health in a very common area. So what is the coping mechanism for this? Because we have seen, we doesn't know what is the major cause, but how to cope with this, because there are definitely remedial measures, and most of the people in the initial or even in the later stages were well managed due to the advanced medical managements. But what is the coping mechanism? First thing is, don't adjust till you exhaust. If you have doubt, please start asking for support. Tell people that what this is my pain threshold and I couldn't bear this. Please help me out with this. So this seeking professional support, not only mental health, gynecological support is also very, very important. And we must, psychologists must bring in support groups for women mental health issues, and we should practice self-care measures, and also we should teach others the self-care measure. The biggest problem today is when we talk about self-care, people think that just doing bleach or doing hair color is self-care. No, that is not self-care. Self-care is having a good physical activity, good mental state, and having a proper relaxation, proper sleep, and altogether makes, as a nourished person, altogether makes a person to be a resilient, and that is very important. Being resilient and being grateful is very, very important for coping with the problems. So what are the effects on daily life? Actually, I have briefed this in every slide, but I want to make it very bold, so I want to repeat and reinforce on this very particular. The women who is suffering from not only endometriosis, any kind of menstrually related mental health issues, their personal life is affected because of emotional distress, their quality of life is affected because of so much of hormonal imbalance, These all together bringing in social isolation. Professional life is also affected because of not only hormonal imbalance but also nutritional deficiencies caused by this. Their impaired concentration and productivity is brought in. Interpersonal conflicts are not able to have a good decision making skills, because whenever there is a magnesium or iron deficiency, mineral deficiency, vitamin deficiency, the decision making skills will reduce, and the conflict and resolution management is reduced. So interpersonal conflicts are increased, and also absenteeism and presenteeism is also in a typical toll. Psychological health, emotionally it is told and increases the stress of the person, and the total mood is always in imbalance. They are not able to easily get back to the resilient way, or they are finding it very difficult to cope up with the problems. So any issues, including cancer, what the current medical system says is early detection and intervention. Early awareness, bring into for the early, if you're not even aware, but when you find there is a problematic things, or you think there is a problem, it is okay, you can be attention seeker, but just go carefully screen and understand that there is no physical cause behind this. So early detection is very important to get a proper response in improving the quality of life, preventing escalations in the mental health, enhances the relationship, optimal work performance is improved, and reduces the stress suicidal risk, because we are seeing hundreds of suicidal cases. Suicidal risk in menstrual mental health is also increasing. So this will be very much reduced. So what are the ways we can treat them in the psychological ways? Because when gynecologists will be taking care of their hormonal area and the gynec area, but this again is should be a combined care. So here everyone plays a allied healthcare professionals plays a very important role, and psychological treatment, especially in a very severe depressed or distressed state. Cognitive behavior therapy helps a lot. Some people will not be severely distressed, but they will be not able to tolerate the pain. During the phase of pain, they are go very mad and wild. So this is like what we call in earlier, it is like hysteria. They suffer when the pain comes, they become very wild, and they behave totally indifferent. So pain management techniques should be taught, and mindfulness based stress reduction has to be taught, because this is not going to happen throughout the month. This is up in some days, low in some days. So what we are supposed to do is they have to focus, mindfully focus on every day, listen to their body, mindfully listen to their body, and understand what I am today. How is my mood elevations today? How should I keep myself calm, composed? How should I talk this area? And how, when the stress is coming, how can I battle it out? So these things should be very properly addressed with mindfulness based stress reduction therapy and interpersonal therapy, because whenever our emotions is very in turmoil, we cannot expect the opponent to always suffocate, right? We cannot keep on scolding another person or opponent. So here the interpersonal therapy has to be taught to this person who is suffering, so that the caregiver becomes little stress free, because otherwise the caregiver also gets all this stress after over a period of time. They cannot able to suffer or listen to all this nuisance. So this interpersonal therapy becomes very important. And in some cases, like when people are like, most commonly what happens is people ask when there is a healthcare problems, why me? So this area, there is some people, they will say no. When it comes to infertility, no, it is not possible. My parents, grandparents, everybody are blessed with children, it is impossible for me. So in such cases, I'm sorry. In such cases, acceptance and commitment therapy, commitment to the treatment, because of the denial, what they will do is they start doing medical shopping. Even today, we are seeing that cyberchondriasis, people started eating whatever internet says, whatever uh, advice comes from internet. Even medication, they are doing self medication. So here acceptance and commitment therapy becomes a very, very important thing. And psychoeducation, creating awareness, is another important idea. And we should teach them what is happening inside your body to understand this is what is happening. For that, we should equip ourselves to understand such medical complications, and we should teach the patient, give them the proper education on what is happening within us. And as said, we can make them into the groups, like 10 15 people. We can make groups and tell them how to connect themselves, how they can share. Because more than any other thing, sharing your problems and sharing the pain is not evaluated with any scale or even thermometer. So this differs from person to person. So here supporter or the same survivor talks about it, that is very easily understood than anybody else. So what are the coping methodology I use to my patients? Because there is no systematic thing already available. So we also learn with every patient, and we use different methods and we learn. So what I'm saying to my patient is, I'm having a menstrual diary. So they have to menstrual diary or menstrual calendar. So every month they have to say every day emotional up, high. I can say like you can give an emoji, 5 emojis. I'm okay, fair, good enough. So they can every day they can just put one emoji in their calendar or the diary, and they can just say that. They may not write anything, or some people may not be allowed to writing everything. So they can just put sad. So they can also have this mood board where this mood temperature can be assessed, and say that today my smile is high, today my smile is low. And another important thing I indulge is nutrition. Balanced meals reduces the pain. Because of this severe pain, inflammation is created. So antioxidative and anti-inflammatory foods must be included, and also include psychobiotics. That is very importantly, the foods with prebiotic and postbiotic. I think I have spoken here or in another session about psychobiotics. So the food with pre and probiotic combination, especially like our Indian traditional foods, we can say channa, or germinated foods, idli dosha, the fermented flours, sangati, ragi, or mudde, all these things, fermented millets. These are all good psychobiotic foods. They have a very good pre and probiotic combinations. So that also helps in reducing the inflammation and reducing the pain threshold. Apart from this, very important is yoga therapy. The flexibility in yoga is very good to reduce the pain, and that resolves the pelvic balance is also taken care of. And some, not some, most of these people suffering with the menstrual related mood disorders, especially endometriosis, they have no energy to exercise. So involve them into the art therapy, especially when you say them get into the dance. That is a wonderful and beautiful thing, works for them. Or they can do column. So whatever way they can involve themselves, some art therapy can be inculcated, and they must take care after they sleep. They should get at least minimum 8 hours, because the oxidative stress can be reduced with a good sleep. So the medicine part will be taken care of the gynecologist. Lifestyle dietary intervention can be dietary intervention. Also, please refer to the dietitian if you are not a dietitian. Lifestyle and psychotherapeutic treatment has to be taken care of by us. And when there is a woman having severe pain and pain threshold is increased, please start using these forgotten traditional foods. I have included very few in this picture. The first one is Malabar spinach. Most of us know it in Tamil Nadu as pasalakira. And next is figs, attiparam. The third one is what we call as piranda. Piranda is again a very good vitamin C rich food. This is a kind of stem into making chutneys and all. This is a very beautiful thing which can reduce the inflammation. Vitamin C helps very good in reducing inflammation, and antioxidative stress is oxidative stress is also reduced. And the third one is red bananas, and last one is this plantain flour. That is very good. actually this luteal hormone displacement is very well controlled by this plantain flower. Most of this women with endometriosis who is supposed, like, who is thought to take this, they say, like, this is for the first time, even no medication has controlled my pain, or no medication like actually supported me getting in 30-35 days periods. This, after eating this plantain flour regularly, we are getting, finding it very very comfortable. So this is also another thing, I'm doing a research on this. So this helps a really lot. This is a wonderful miraculous food which was given by nature for us. And potukadala, this is a very roasted Bengal gram, we say in English. Very very wonderful food, magical, good amount of protein is there, and it has a very good substances like short chain fatty acids and all those things, which is going to help you in every kind of health related things. So these are the very magical foods, but now we are totally forgetting such traditional foods and locally available foods, and or we can even call them as our local wild foods, and we are moving out to the different tradition. At least for this, people with the pain, suffering with pain, please advise to take these things that are very helpful. And good sleep is very important. Thank you.
Yeah, thank you, Sriti.
Any questions, ma'am? Yes, ma'am.
Good evening, ma'am.
Good evening, ma'am.
Good explanation, ma'am. Because nowadays, mostly the ladies are facing these problems, and after marriage and after children, and leading with the duties and homework, means householding works, they have to handle a lot. And good explanation about the diet and yoga also. Can I know about the yoga asanas? What we can guide them, ma'am?
Basically, I'm not a yoga therapist, but I
Okay.
send my patients to good yoga therapists around me. And actually, this yoga therapist who has masters can specifically, those with masters can help us with these fertility related yoga practices. So we can connect with them. But very commonly, what they are teaching my patients is very important. This butterfly asana and this animal poses, cow pose, cat pose, and all those things. And Surya Namaskar is always very important for any other things. And these are the few yogas like I heard from my patients. But yoga therapy helps them a lot. But I'm not into that deeply. I do Surya Namaskar for myself, and I do very little yoga and walk.
Okay, ma'am. Thanks a lot. Nice and good explanation, ma'am.
There are many yogas even for fertility boosting, but that we have to meet a proper therapist. We cannot advise on that.
Okay, ma'am. Thank you. Thank you, Sunanda, ma'am.
Any questions you can talk. If you're finding difficult, you can post in the chat box. Yes.
Very nice. Good evening, madam. Very nice observing speech here. One doubt that psychobiotics means what you are meaning by that?
Psychobiotics is like gut microbiomes, sir. This gut microbiomes of prebiotics, probiotics you have heard about, symbiotics and all. So psychobiotics are the specific strains. There are some 7 different specific strains, mainly Bifidobacterium family and Lactobacillus family. There are 7 different strains. they enhances the mood and elevates the positive thoughts. This is what psychobiotics we use, and bringing a lot of resilience, coping and resilience in people, because this gut microbiome, vagus nerves are directly related to our mental health.
Okay, thank you.
Food also, like we can say this paraya sadam and ragi cool or curd, buttermilk. Buttermilk is wonderful psychobiotic, idli dosha. These things also called as, like, even germinated, like what we call sprouted salads, channas, salads, those things sprouted, overnight soaked and sprouted into 3 to 7 days sprouting is enough. That also has a very good psychobiotic properties. Yes, Bengal. Any pulses and legumes which can be like sprouted and included.
Yeah, you said that buttermilk is a psychobiotic. Now, homemade buttermilk, from where does it get those bacterial culture, lactobacillus, and all those things? If you are making yogurt in your home,
So actually, lactobacillus is like when the milk is cultivated and when the milk is totally changed, cultured, the lactobacillus is developed. Lactobacillus is developed from the milk only.
but here in USA, when they make the yogurt, again from the milk, 90% of the yogurt doesn't have any bacilli. They specifically add the lactobacilli. Then so how come that in India at home when we make the buttermilk,
Temperature.
you get the lactobacilli?
Temperature. The US temperature is very cold. India, it is like tropical climate.
But again, it's an organism. Unless
Yes,
there's
sir.
an organism, it is not going to grow. Doesn't
So
make any
actually,
sense. Huh.
actually, in US, the milk also is been long time. It is a powdered milk, so they have to add lactobacillus to the milk to grow or culture foods. Right here, most commonly, it is milk is from cow.
I'm sorry. I'm sorry to disagree with those comments. I'm sorry. That's not true. Thank you.
Okay. Thank you.
I cleared my doubt, ma'am. Not now, ma'am. Yeah, I cleared my doubt, ma'am. Thanks.
Hello, good evening, ma'am.
Good evening, Priyanka.
Ma'am, I want to ask that is curd avoided in the periods or not? Like you said, buttermilk and curd is helping, but in North India, we are avoid to said.
Actually, this maybe I'm not very sure about why they are saying I avoid during periods. I'm not very sure about that cultural practices. But during rainy seasons, everybody says because we take head bath and all, and your immunity is already less. So they will advise you to better avoid such foods which can induce cold and cough. Even we say vitamin C rich foods and all to be avoided. But
Okay,
that's
thanks,
not
ma'am.
scientifically allowed. That was in cultural practice. That's all. Thank you, ma'am. Yes, ma'am. Thank you, ma'am. Thank you for that.
Thank you.